glad to introduce to you our penultimate event, and we are going to be in for a treat today. We're listening to the Tony Blair Institute host an event called What is the Legacy of COVID-19 for Government and Digital Public Services? Invariably, you'll hear lots of things which will interest you, and we would love you to tweet them out at CogX 2020. I'm now going to hand over to Chris Yu to introduce all of the panelists. Chris is the Executive Director of Technology and Public Policy at the Tony Blair Institute. So over to you, Chris. Really looking forward to the discussion.
Fantastic. Thank you so much, and welcome everybody to this afternoon's session on the COVID-19 legacy for government and public services. So I'm Chris. I am Exec Director at the Tony Blair Institute, and I run all of our policy work on technology and the way that this will impact the policy environment moving forwards. For those of you who aren't aware of our work, the Tony Blair Institute is a not-for-profit that focuses on equipping leaders to navigate the modern political and policy environment. And technology is a big part of our work because it's one of the most important themes and challenges that we think leaders in the public and private sector need to get a grip on in order to build successful, prosperous, and open societies. So for this session, we're going to explore the way that COVID-19 has impacted on government and the public sector. We will look at some of the ways in which public services have struggled and in other ways come into their own using digital and technology. And we will explore how this will affect the longer term prospects for digital government, public services, and the way that we organize the state. I'm really excited to have a couple of great guests joining me for this session. So on your screen now, you can see Hannah Johnson, who is Chief Operating Officer at Public, which focuses on helping GovTech startups innovate and operate in partnership with the public sector. Hannah was before Public in government for a number of years at DCMS and at Number 10. And before that has worked in the charity sector and in consulting at Accenture. And the second guest is Theo Blackwell, who is Chief Digital Officer for London. Theo was appointed in 2017 as the city's first Chief Digital Officer. He leads on London-wide digital strategy and transformation, as well as looking after data and smart city initiatives at City Hall. So has a great perspective on the way this is playing out across public services and in the capital. Now, the way we'll run the session is let Hannah and Theo both just give us some framing remarks on the topic and the issues as they see them, drawing on their experience and the fields they've been working in. And then we'll broaden out to a discussion amongst the three of us around some of the topics that I outlined towards the start. So what we'll do, Theo, I think you've got some slides to talk to as well. So we'll start with you, and I will let you just lead us off on digital public services and transformation from your perspective in London.
Great. Thank you, Chris, and Tony Blair Institute and CogX. Nice to see you. Hannah from Public, where I spent 6 months before I became Chief Digital Officer. And good afternoon, everyone. So if you could put up the first slide, please. Whoever's controlling the slides. Yes, great. So my name's Theo Blackwell. I'm the Chief Digital Officer for London. As Chris said, appointed 2.5 years ago. Previously had experience in the games industry with Public, and I was a long-term councillor for Camden Council. So I've stayed close to that local government community in City Hall. And I just want to make some sort of opening observations about the pandemic recovery, and in a sense, how change has very much accelerated, but some of the issues that we were tackling before the crisis essentially are the same ones. So if you could move to the next slide, please. Great. So I think, you know, we are in a potential moment of transition here. We have a very strong focus on economic recovery at City Hall. As the true extent of the economic challenges come out, we need to look to innovation and particularly data to find more effective ways of intervening in the economy and supporting those businesses through this change. There's also a second moment of transition going on. And actually, the second and third one, digitisation and climate change, really well framed by Chancellor Angela Merkel, that these were sort of pre-existing shifts going on, but we could see them sort of writ large during the crisis. Digitisation. Many organisations had to move from having introduced remote working to mass remote working during this crisis. Now, from a London Council perspective, that meant moving all staff, including frontline staff, into remote working. Some councils reported up to 95% of staff were had to be given laptops and suddenly introduced, as we all were, into the world of Teams and Zoom. And there's also the big challenge of climate change and the discussion going on that in these moments where cities were locked down, people could see the improvements in air quality. And then we consider how mass transit systems work with only 25% capacity for safety reasons. How do we encourage cycling, electric vehicles, and other forms of transportation? And I think you can add to that in the last 2 weeks, another moment of transition in that social justice and inequality concerns have really come to the fore in Europe and the United States in particular. And that's a key part of our recovery discussion. But against that, we have a countervailing wind, if you like. And that will be pressure on city governments from some quarters not to see this as a moment of massive change, but actually that their efforts should be back to normal, that we should focus on getting things back to business as usual. So I kind of put a note of caution into the minds of people who say that this is a moment where we can suddenly take things off the shelf and it could be a moment of massive change, because that might not be accepted by all. Next slide, please. So in the field of digitization, I think one of the most important things to come out of the crisis was, in a sense, a refocusing of digital inclusion initiatives, which had tended to move away from a discussion of access and, to a certain extent, skills, and more onto the question of or the issue of design. So if you look at the latest government iterations of digital inclusion, they focus very much on how we design platforms for the maximum number of people and looking at their user journey. That is, of course, extremely important in all of the things that we do. But immediately, we faced a large portion of the population in London who might have had devices but didn't know how to use them. We had voluntary organisations on the ground that were mobilising volunteers for things like food deliveries and medicine deliveries that didn't have the capacity to work remotely, and therefore a need emerged very much to support the digital transition of the voluntary and community sector to support local government in a moment of crisis. And of course, the issue of access, to ensure access to devices for those who are digitally excluded. And this, given that the government places great importance and has placed great importance on the NHS app, it is important that all Londoners have access to devices that they can use the app. Obviously, there are other channels such as call centres and online services, so people can report their symptoms. But if the app is to be effective, we need to have as many people as possible using it. So access to those devices, which is a very tricky issue. How do you give people devices who don't have them? How is that funded and how is that supported? Is a potentially immense task for local government. Next slide, please. The second area in the digitization theme that really became live during the crisis was the importance of joined up and real-time or near real-time data. London local government and City Hall has had a very rich history of using data, open data for analysis, usually on a monthly and quarterly basis. But the immediate crisis to see if the public services supporting London were okay in the moment of crisis meant that decision makers suddenly had to join up vast data sets that they'd never really joined up before. And that, I think, exposed issues of capacity, capability, and governance, data sharing, as well as trying to negotiate the various technology platforms that were out there. But nonetheless, I think there were some real lessons learned by decision makers that reaffirmed the case of people like me and London Office of Technology and Innovation, saying real-time data was an important tool. Firstly, we're able to gain actionable insights on a London-wide level on areas such as the flow of patients, number of ill people, mortuary capacity, and take action on them. We're able to see the bigger picture to understand longer-term trends in London to support recovery. We're able to identify emerging citizen needs. The government supplied us with a shielded list right at the beginning, where people who are most, extremely vulnerable, and if they'd got sick, would have, they had to take extra measures to isolate themselves, the shielded group. But there was a whole level of vulnerability beyond that we had, that was identifying itself to local authorities, that local authorities had to support. So the ability to actually understand that need and match it with services and volunteering was extremely important. Real-time data enabled us to create new services from scratch. Local authorities in London started doing food delivery services and building a digital service around that in the space of a week. That relied heavily on the ability for them to analyze data, make decisions, and for that data to be high quality. We're able to give transparency to the problem. The government often changed the parameters, if you like, of the data sets around COVID deaths. And so if you look at our COVID map on the GLA data store, that brings together a whole range of data sets that allowed us a level of granularity to decision makers and the public around the impact of COVID deaths, and allowed us to look into things like the impact on Black and minority ethnic community and those people with on low incomes as well. And finally, we're able to mobilize using real-time data, form new data partnerships to meet city objectives. And the chief of these is the repurposing of our work on air quality with the Turing Institute to use AI and machine learning from largely transport information, but potentially other data sets from including the private sector, to look at how busy London is, which isn't just important as we analyse the impact and effectiveness of restrictions, but also the busyness of high streets as well. Final slide, please. And the third area that I think this is really shown, and this has really been triggered by the digital contact tracing app discussion, is we need a better structure in London and other cities about emerging technology. Now, a lot of these debates have played out in previous discussions about things like live facial recognition technology, connected autonomous vehicles, drones, and so on. But the contact tracing app really brought to the fore and is, in a sense, one part of a bigger picture of technologies that I think will be put in place, usually in private hands from businesses and landowners and others, which could include heat sensing technology, tokenization of access, and so on. These may well be compliant with GDPR, but are they compliant with the values of our city? And I think we need to bring together the learning that we've had from the police ethics panel on facial recognition technology, our learning around talking to the tech industry on our connected autonomous vehicle trials. There's some common threads that come out of this that really allow us to consider the impact, ensure consistency, and improve public dialogue. Thank you.
Okay, Theo, fantastic, super interesting. And I want us to come back to a lot of the points that you raised there in the discussion, particularly around the role of data and real-time data, this question of technology in private hands and how that rubs up against government and public services. And I think crucially, this question around whether, despite the optimism that some people have about this being a new dawn, maybe it might be more realistic to think that we slide back into how things were before. So all of that to chew over when we get to the discussion. First of all, I'd like to bring in Hannah just to give us a perspective from public and from the startup community, and maybe tell us a bit about how things look from that perspective. I know you've been working with the NHS, for example, to bring entrepreneurs and startups into that space. Would be fascinated to get your take.
Great, thanks, Chris. I suppose from my point of view, and I'm not going to use any slides here, but to start with, I suppose 3 reflections from the work we've been doing, what we've been seeing, but also more generally. I think first of all, obviously, COVID-19 has been a forceful way of accelerating digital services, whether it's kind of video consultations with your GP, other kinds of telehealth, education on the internet, PE on your television, or court and tribunal hearings online. So it has pushed forward and made happen some things that have been in the works for a while. Those examples are very much the front end and quite well documented. But to give one example from the back end, one of the companies we work with, Patchwork Health, COVID-19 has helped them to push through some of the barriers of working between hospital trusts to create the London Staff Bank, which bridges the gap between 14 London hospitals and brings together a single staff bank for those hospitals in London to fill shifts, whether for COVID or for business as usual healthcare. Before COVID, they had a painstaking job going trust to trust, which I'm sure anyone who sells into the health system will understand. So their kind of COVID has really broken down barriers. It's pushed forward the kind of services that people are seeing. Secondly, I think we've seen government being forced to work in different ways. When a pandemic hits, you don't have the luxury of time to go through your usual sales cycle. You can't carefully select one horse, develop the business case, and then back that one solution. You need to test, iterate, and then scale what works. And that's what we did with NHSX in the Tech Force programme, where we went from kind of ideation with NHSX to having 1,600 applications to help with some of the not the clinical problems that they were facing, but more of the community issues, so isolation and mental health, remote social care, and optimizing staffing. That process really helped us get very quickly to 1,600 potential solutions for those problems. We've just finished 3-week trials with each of them and are now looking at the results of those trials so that we can scale things up. And the brilliant team we work with at NHSX and at AHSN, the Academic Health Science Network, they're used to working relatively quickly, but they had to work in an even quicker way, get comfortable working in that way, be more agile, more iterative, be faster than might be comfortable. But ultimately, that allowed us to be responsive to the situation at hand and to draw on this kind of huge and very willing startup ecosystem that had solutions that could solve public policy problems. And I think that really helped to provide a window into that ecosystem as well. In a more prosaic way, Theo touched on this, but working from home has been a big change for government, particularly if you think of it in a kind of Whitehall government sense of the word. I'm not sure that any of the ministers I ever worked with would voluntarily have conducted their meetings over Zoom. But by the time we get back to peacetime, they will have been doing that for coming up 9 months potentially, and that's a real opportunity for change, an opportunity to explore potentially a more decentralised Whitehall, a less London-centric government, and with that potentially a more representative civil service. But I suppose that brings me on to the third point I wanted to make, which is just that word opportunity is the key one. Because I think whatever has happened and whatever services have been tried out and different ways of working that have emerged through the COVID crisis, none of it is a silver bullet. And without, and again, Theo touched on this as well, without taking advantage of that opportunity, there is a real danger that we slide back to the comfortable way things were. None of the underlying issues that held back transformation have changed. If anything, this has proven that the technologies were there, but that the enablers were not. So things like legacy systems, lack of cloud infrastructure, interoperability, the kind of data that we have available in government, hasn't changed because of COVID. So unless we really tackle that and use this as a chance for reform, continuing efforts will still be difficult and slow. So if anything, I think going back to the original point about the legacy for COVID, I think it really should be as a catalyst for reform, to capture the best of what we've had to implement, but really to change the underlying problems that have held us back in the past.
Fantastic, thank you. And I think all those points so well made, and one that really resonates with me is that question of whether ministers and people in positions of power who are now used to working from home and using the technology, whether that will affect the institutions that they run. I mean, I remember many years ago being a civil servant, and it was a struggle to set a conference call up, let alone a video conference. But if maybe we get people into a more digital mindset, then we have a shot. So where I'd like to start the discussion is somewhere where I think Theo, you're like working inside government, and Hannah, you work very closely with the public sector with all these startups. The thing that puzzles me sometimes, sitting on the outside of this environment, is the extent to which COVID has shown that things that seemed impossible for many years, right? Like the idea that I could get a video consultation with my family doctor, or that certain public services could move online. Things that I'd been told for so long were too difficult, or were impossible, or were just not the way that we did things. And it turns out that actually they are entirely possible. Is this because something has changed? Or have we made exceptional rule changes that suddenly are unlocking all of this? Or is it just a question of the crisis has focused minds and we could have done it all along?
Do you want to jump in, or shall I go first, Theo?
Why don't you go first? Yeah.
Chris, I think it's probably a bit of both. With the example you give of video consultations, obviously the fact that was the only way to see your GP gives a push to those people who might not have wanted to adopt that sort of technology. But it also relied on some pretty hard yards from some of the enabling companies. We know well Accurex, who worked over the course of a weekend to build a video consultation tool to roll out the GPs that they worked with. The technology was there, but this pushed them over the edge in order to adopt it quickly. And then in other cases, I think some of it came from laying groundwork over some time. So in the case of kind of courts and tribunals, which have managed to get, I think they said they had 90% of their caseload going online. A lot of that comes from the great leadership of Susan Backlund-Hood, who's been leading that and who's been looking at digitization for a long time. So I think being ready and then having the push that gets you over the edge, and obviously the hard yards of the companies who've helped to facilitate it.
What about in London, Theo? I mean, have you had to to do some of the things that you described? Was it a case actually of suspending certain rules or forcing changes through, or are you actually working within the same parameters, just with now we've got a much clearer mission?
So I think there are two things going on. One is necessity, the key driver. Everybody at once was focused on was focused on the same broad thing. Mm-hmm. So that kind of moment of unity meant that when you're working in an environment with 32 boroughs and 40 NHS trusts and so on, that rarely comes along. You can pick any other topic, whether it's youth violence or climate change, and at any one time, it might not be the top priority. for all of those organizations. So this kind of moment where it's all fixed on one thing certainly helped. Secondly, there was a demand for sort of two things: a big London-wide picture. If you're in a borough, it's like, how am I doing it? And compared to other people, what can I learn from them? And for the people who were in charge of the emergency response in the strategic group responsible for that was made up of the GLA and some London leaders. This real need to see the London picture. So there are two examples I'd give. One kind of relatively small and one quite big, of where things really came together quite quickly. We'd been doing quite a lot of work on data sharing in London, and what we needed during the crisis was, as a proxy for kind of vulnerability, we often use free school meals. So there's a vulnerable family may well be in receipt of free school meals, but some children are schooled outside of the borough that they live in. So how do you identify that person and put them in touch with the borough? That requires a data sharing agreement. Now, I'm not saying that the picture is completely like this, but if you tried to get 32 boroughs to give data sharing agreements, which each of the 32 boroughs 32 times, I think that's over 500 separate data sharing agreements, all on the same thing, very small numbers of people in each category. So our ability to talk to information governance groups and essentially streamline that process through the GLA, we were able to do that much more quickly and put a proposition before you went to talk to the lawyers in about a week. That could have taken months before. The second thing is the acceleration point, I suppose, that we mentioned before. There was work already underway to join up the health and social care data, which is extremely federated in London. That's essentially a 2.5-year program, which is pretty quick in old times, in any case. And we've now joined up effectively 3/4 of the patients' data in London. So that rapidly accelerated the ongoing program, because people really needed to know that interface between medical data and social care data in order to protect the most vulnerable. So yes, that big moment of unity and necessity totally changed things.
I wonder if I can quickly pick up on one of the points Theo made there about unity and the kind of aligning of incentives. I think that's a really important one, and it's maybe maybe not so much it's maybe a lesson learned and something that could be part of the legacy of COVID-19. Is just how government organises itself to meet some of the big challenges that it faces. COVID-19 has obviously been one of them. Theo mentioned climate change earlier. That is another. Aligning those interests. If it's taught us anything, COVID-19 shows us that problems don't fall neatly by departmental lines. It's not just been a healthcare problem. It's been a supply chain problem. It's been a problem in delivering public services to people. It's been it is a huge economic challenge as well. And so kind of it may well be a legacy as how government organises itself to solve those problems, looking beyond departmental lines.
Yeah, absolutely. And I wonder sometimes, could this be the breakout moment for a lot of the debate around government as a platform? So, Theo, you mentioned, joining and sharing the data between different boroughs, and we've talked about, all the different components of the NHS that need to work together. Mark Thompson had this great article in Computer Weekly a little while ago, and it was all about, kind of platform government. And he described this analogy that I thought was really interesting around, about Magic FM, right? And the idea that actually lots of the stuff behind the scenes is the same, right? So you need to architect common playlists and all the infrastructure required to get yourself on air. And then you personalize the bit that matters locally, right? So like the local traffic is different and the local news is different, but everything else is consumed as a service. And like government is nothing like that, right? Government is like all these different entities jostling, and we spend forever trying to join them up and find all the touch points. Like, do you think maybe in this kind of mindset and culture shift, like what we've all been through, gives us an opportunity actually to pivot to that model?
Yeah, well, I think the other driver in this, Chris and Hannah, is effectively the substantial budget cuts that local government will be faced through decreased revenue and whatever the settlement is with central government. And I think they are planning for a pretty bleak picture. I think that will, seriously give rise to questions like, why do we have 32 pieces of technology that do the same thing across London? So the most important thing I think we can do now to make ourselves ready for those discussions is what we call fixing the plumbing, doing that basic work to make that transition as seamless as possible. So we've produced, for example, a kind of online audit. It's available through open data of it's effectively a big map of all of the services local government provides and the technology that sits behind them and when the contracts run out. And so that enables us to give a view not solely of the kind of technology mix put in place, but also the potential savings and innovation that could happen as we regularize that. And that's, I think, the first step towards moving towards a platform discussion is doing that hard work. Because, final point, I think people would be really surprised to know, or they might not be surprised, that, if you asked government what the technology picture was like across the NHS and across local government, the key services that you use each day, they would not be able to give you an answer. There is no picture of it. There is no overview of it. So we're just trying to do that for London.
Yeah. And to potentially torture the analogy slightly, it's like fix the plumbing and also use a set of common sockets so that other people can plug in, right? Because you want like civil society and startups, as well as all the kind of usual suspects in big tech, to be involved and help where they can, right?
Yeah. Absolutely. I agree with everything that Theo said about fixing the plumbing. I also agree about the point about keeping the same sockets so everyone can plug in. I think it requires a bit more than that as well. I think there's a kind of cultural change that needs to happen too, which is to convince people, this system's grown up because everybody thinks that they are, special to a certain extent, that the tech they need or the solution they need is very bespoke and that they do something differently to everybody else. And a lot of what we found through the work we've done, particularly the research reports that we've done looking into particular sectors like police tech, is when you get down to the core of it, actually the sorts of tech that they need are not very different from what other people need. But just changing that kind of cultural attitude to sharing and looking for commonalities is quite important as well.
Yeah. So, I mean, a lot of what we've talked about thus far has been to do with the sort of mindsets and culture inside the public sector. I want to come back to something that, Theo, you mentioned in your comments at the beginning around like whether people are going to be embracing change or actually kind of resistant to it, and whether we, like on the spectrum of, kind of Brave New World or sliding back to how things were. And an example I've got is, the kind of, I think about my experience with government and public services, and like in the past, maybe I would have accepted that my interactions with different bits of government were not as sophisticated or as kind of friction-free as they are with some of the like consumer tech in my life, but I would cut the public sector some slack because I know it's hard, I know it's complicated, they haven't got the budgets and so on and so forth. I wonder now that we've all like been forced into this very unusual situation, now that we've seen actually that things are possible that seem difficult for so long, like I wonder whether the public actually won't tolerate us going back. That if you say to me, you know what, you've been able to have a video consultation with your GP for the last X number of months, but from September you can't, I'm not sure people are up for that. But I'd be interested in your perspective.
Yeah, I definitely think that it will change the pressure of expectations on public services, and that will be a further push towards digitization. But sort of slightly obliquely, let's just remember during this crisis, there were kind of there are a number of different lived experiences that people had. So, and it's sort of in the eye of the beholder. So, let's take, for example, traffic and the environment. Some people during restrictions might have been going to the shops and walking down the middle of the road for the first time because there were no cars and going, isn't that amazing? Other people will have been, buying a bike in expectation because they don't want to use public transport, and they will have bought a bike in expectation of cycling in and look forward to it. And another group of people might have been driving around in a car at 60 miles an hour going, this is great, because there are no other cars on the street. So I think, we just need to be very careful in this discussion that people had different experiences on this. And so this is where the design discussion comes into it, that we can't just reach for technology solutions here. We really need to understand our users. And what the crisis did show us, where we produced really, really good services really, really quickly, is that they were done in an agile way, using design principles, and we were able to do good stuff really quickly because we understood our user need. And I think that's quite a deep lesson that some public services will have taken away from this, others perhaps not.
Yeah, and there's a kind of really important question of equity in here as well, right? Because if government doesn't step up on some of these services, then what you potentially end up with is, opening up some new divides. I mean, Theo, you mentioned devices in your presentation, and one of the things we've been looking at the Institute recently has been around sort of testing and digital identity and how you safely reopen some high-risk spaces. And one of the things that I worry about is that if government doesn't step up on this, then you end up with those who can put the infrastructure in place do, and you have something which maybe feels relatively normal if you work for, I don't know, like a big bank or a big law firm. You get tested on the way into the office, you've got a credential which lets you come and go in a relatively friction-free way. Some of the private schools are heading in that direction, and for everybody else, it's like, well, lockdown carries on, or you take your chances. So working out like what that's going to mean, and then I think how that ties back into the fabric of our lives. Actually, a really hard question.
I think that school example particularly is a really stark one. If you have private schools able to do the kind of ubiquitous testing that's required and the constant testing that's required to provide people with that sort of passport, but state schools don't offer that, then the divide in our education system is it's set in stone for the next generation.
Yeah, and just going back to the point I made about emerging technologies discussion, a charter for London to structure and inform the dialogue with innovators and with the public. I think it's just now more than ever needed. When the police trialled live facial recognition, they put in an ethics panel, but then the debate also kicked off because a landowner had basically just implemented some facial recognition, and people were sort of so well, I can understand the rules around the police doing it, but what's happening over there? Especially when we're looking at public spaces that people perceive as public, but are in fact private. Which, if you think about the future of London and 40 areas that are going to be built over the next 20 years, most of them will be public-private spaces. So that relationship with technology and the built environment and people's sense of place and fairness, it's really, really important.
I think it really highlights the need for more leadership on this sort of an issue within government. We've talked about some kind of individual examples with NHSX, with HMCTS, Theo in London. But when we look forward to the future and think about how we can keep some of these transformations in place, or what we keep in place and what we need to make a move on quickly to keep up with those expectations, which, as you say, Chris, I think actually have been there for a long time, because people can do everything else in their life digitally, and government is the one that is lagging behind. It really kind of highlights the need for that leadership. The government's been trying to hire a CDIO for the last, I think, 18 months. I think it's failed 2 or 3 times to find the right person. Maybe Theo wants to step up. But having that leadership, if you think back to where the last time government made big strides forward in digital transformation, it was around the sort of early 2010s. It was when complements together of really strong political leadership, structures in the civil service that were put in place to really drive things forward, and a really disruptive team there, and strong backing from the Treasury to kind of fund some of those activities and be strategic about that. And I think we need to get that kind of triangle back in order to make sure we move forward in the right way.
Yeah, I agree with that.
Do you think we also need some? Do you think we need some new institutions? Because I feel like a lot of the time we talk about how do we equip what we've currently got in order to make a better fist of this whole digital thing. I mean, Theo, your charter is a great example of maybe a sort of slightly different way of thinking about the problem. But I do sometimes wonder, the whole kind of consultation by PDF, and people debate it in the Houses of Parliament, and maybe they get it and maybe they don't. And whereas on the outside, this kind of vibrant, chaotic debate about the world we live in and the causes that matter to people and the way that our communities are. Do you think we need to, I don't know how, right? And we've been doing some thinking around the kind of digitalization of democracy, and we've learned a lot even, right, from moving Parliament online, albeit temporarily. Maybe there are some different ways of bringing the public into this conversation, as well as kind of all of the good work to build platforms and do the kind of strategic missions.
Yeah, I think this is, look, we need, I mean, in London, what we've been building is basically new institutions to support delivery. We've got Transport Innovation Team at Transport for London that essentially is created after Uber came to town, because it was like, we need some headspace to think about the relationship between when new technologies drop and how we receive them. The London Office of Technology and Innovation, bringing together about half of the London boroughs to think about delivery and data. I think that in a sense, we don't need, I mean, it's for national government to decide whether they need institutions like, to have an overview of data. That might be a good idea. But in London, what we've tried to develop is institutions to support delivery. And that's where I think you get into the conversation with citizens, because if you take a user-centered agile approach, it automatically plugs you into, what's the user need? What's our hypothesis? How do we test that hypothesis and iterate? And taking that digital sort of way of thinking and slowly applying it to policy, which is increasingly getting digitized anyway, is a tremendous moment for what in old money was called co-production.
Yeah. And I think it's one of the reasons why I'm so excited about bringing more entrepreneurs and startups into public services. Not because I necessarily think that one is better than the other, but it's the different perspectives and different mindsets coming together that's often so powerful. And like you say, the kind of relentless focus on delivery and user needs is something which you have to have in a commercial environment. It's not always appropriate in government, but often, particularly when you're front line, really matters, right?
Right.
Absolutely.
Okay, I think we are coming right up against time. We're going to run a Q&A session after this, I think in 15 minutes, for folk who are able to stay around and pop questions in, and we will try to pick up as many of those and discuss the points that people want to. For this session, I mean, we've really done the full tour through everything from COVID-19 crisis response via real-time data, NHS trusts, and goodness knows what else. I think on balance, I am optimistic about the future. I think this is an opportunity for us to get a lot of things right. I'm sure it won't be easy, but I think for me, we've got a sense of what is possible. And I think with the right folk involved, it ought to be possible to get some of that to stick. So look, I'm just going to say thank you very much to Theo and to Hannah for joining us for this session. Thank you so much to CogX for hosting, and for everybody watching for being part of the conversation. Hopefully see lots of you shortly for the Q&A. Thank you very much.
Great. Thanks for listening.
Thanks.
Want access to more CogX videos? Subscribe now for free at cogx.co.